All right, let's jump into another deep dive. Today, we're exploring a topic that I find really fascinating, and that's Cushing's disease treatment. It gets pretty complex, so we've got some interesting research to dig through. And just to be sure we're all on the same page, Cushing's disease is caused by a tumor in the pituitary gland, which, as we know, controls a lot of hormones. And this tumor causes the gland to overproduce cortisol.
Yeah, even though the pituitary gland is super tiny, it's about the size of a pea. But when you have this excess cortisol, it really throws things off.
Oh, absolutely. It's like a tiny little dictator wreaking havoc on the whole system. So let's dive into the first treatment approach, transphenoidal surgery.
Yeah.
Now, this sounds pretty intense. They go through the nose or upper lip to reach the brain.
It sounds dramatic,
Mhm.
but it's the best way for surgeons to get to the pituitary gland,
Hmm.
without having to disrupt all the surrounding brain tissue. And the techniques they use now are so much better than they used to be. It used to be all about microscopes, but now a lot of surgeons are using endoscopes.
Endoscopes. So like a tiny little camera navigating through the brain.
Yeah, exactly. It's like a miniature submarine with a light and a camera on the end. So the surgeon can get a close-up view of the tumor and operate with incredible precision.
That's amazing. I mean, I imagine the surgeon's skill must play a huge role in how successful the surgery is.
Definitely. Yeah, the cure rates for transphenoidal surgery can actually range from 0% to 90%, which is a huge difference. And that depends on the expertise of this surgeon and other factors too. It really emphasizes how crucial it is to find a surgeon who specializes in this particular procedure.
Right. You want someone who's done this a million times. So when the surgery goes well, does that basically reset the system?
Right.
Like allow the body to get back to its normal hormonal balance?
Yeah, that's the goal.
Yeah,
In a lot of cases, surgery can actually lead to long-term remission, which basically means the disease is considered cured.
that's great. But I was reading one of the articles and it mentioned Cushing's coming back, even after a seemingly successful surgery.
Yeah.
So why does that happen?
Well, even though the surgeons are really skilled, sometimes they run into challenges trying to remove every single tumor cell. These tumors, they often grow within the pituitary gland itself, and they intertwine with the blood vessels and nerves in the area. It's very delicate. And sometimes, even if they get the visible tumor out, tiny little microscopic tumor cells can be left behind.
And then those remnants can regrow
Exactly.
and cause the disease to come back.
Unfortunately, yes. And this recurrence can happen months later or even years later.
So even if you're feeling great after surgery, it's super important to have regular checkup.
Oh, absolutely. Long-term monitoring is key for anyone who's been treated for Cushing's, no matter what treatment method they had,
Yeah.
because it helps catch any signs of the disease coming back early.
Okay, so that's surgery. Now let's move on to the other major treatment option, which is pituitary irradiation.
Okay.
So this one uses focused beams of radiation to target the tumor, and it works by damaging the cells over time.
Right.
Now, it seems like radiation works a lot slower than surgery.
Yeah, it does.
One of the articles mentioned it can take up to 2 years to see the full effects.
That's true. Yeah, unlike surgery, where the goal is to remove the tumor quickly, radiation works much more gradually.
Mm.
So the radiation basically damages the DNA of the tumor cells, so they can't multiply anymore. And then eventually that leads to their death.
So it's like a slow and steady attack. So while we wait for that to happen, what are some of the benefits of taking this slower approach?
Well, for one, radiation is less invasive than surgery. There's no cutting involved,
Yeah.
and you don't have to go through the nasal cavity. And some studies have shown that radiation might actually reduce the risk of a specific complication called Nelson syndrome.
Nelson syndrome. Can you
Yeah.
explain what that is?
Sure. So Nelson syndrome, it's a rare condition. That can happen after the adrenal glands have been removed. So sometimes what happens is that in response to removing those adrenal glands, the pituitary tumor can actually become more aggressive and start to grow rapidly. And radiation therapy to the pituitary may help prevent that.
Oh, wow. Okay. So radiation can potentially prevent that complication,
Yeah.
and it's less invasive, but I'm assuming it also comes with some downsides.
Yeah.
What are some of those?
Well, one major concern with pituitary irradiation is that it can affect other hormones produced by the pituitary gland.
Right, right. I forgot that the pituitary gland is responsible for so many different hormones.
It is.
So what kind of impact does radiation have on those other hormones?
Well, you can kind of think of the pituitary gland as the conductor of an orchestra.
Yeah.
Releases all these hormones
Mm.
that regulate things like growth and metabolism and reproduction, all these important bodily functions. And when radiation is used, it can sometimes affect those musicians in the orchestra. the cells that produce these hormones.
So it's like some of the instruments in the orchestra might go out of tune or even stop playing altogether.
Exactly. And that can lead to a whole bunch of hormone deficiencies. So, for example, the production of growth hormone, thyroid-stimulating hormone, or even hormones related to sexual function can be affected. And often those deficiencies mean that the patient will have to be on hormone replacement therapy for the rest of their life.
So it's a trade-off. Less invasive, but with the potential for needing to be on hormone replacement long-term.
Right.
That sounds like a really tough decision.
It definitely is. Choosing between surgery and radiation is never easy. There's no right answer for everyone.
No, I imagine not. So what are some of the factors that go into making that decision?
That's a great question.
Yeah.
And that's exactly what we'll be exploring next.
Sounds good. We'll take a quick break and then come back to talk about how doctors and patients navigate this really difficult decision.
Okay. Yeah, it really is, like you said, navigating a maze, trying to figure out the best treatment option.
Right. Like, what are some of the key things that doctors and patients consider when trying to decide between surgery and radiation for Cushing's?
Well, one of the biggest factors is the patient's age. So for younger patients, especially children, radiation is often preferred because radiation to the pituitary gland during childhood can actually interfere with growth and development. So surgery is often the go-to choice for adults, while radiation is often a better choice for younger patients.
That makes sense. I imagine the size of the tumor also plays a role.
Oh, absolutely. Yeah, the size and location of the tumor can really impact what decision is made. So smaller tumors, particularly those called microadenomas, which are less than 10 millimeters, those are often easier to remove surgically, and they have a higher cure rate.
Why is that? Is it just because they're smaller, so they're easier to get to?
Yeah, partly. But there's also an anatomical reason. Microadenomas tend to be more confined within the pituitary gland, so they're less likely to have extended into the surrounding structures, which makes them easier to get to during surgery. Think of it like plucking an apple from a tree. It's a lot easier when it's just hanging there, as opposed to when it's wedged in a branch.
Yeah. Oh, that's a great analogy. But even with smaller tumors, there's always that chance of recurrence. We talked about those little tumor cells that can sometimes linger. So is there anything that can be done to minimize that risk, like the risk of the disease coming back?
Well, unfortunately, there's no way to guarantee that every single tumor cell will be removed or destroyed. But there are definitely things patients can do to improve their odds.
Like what?
Well, I think the most important thing is making sure to follow up with your doctor regularly. Keeping up with those checkups with your endocrinologist. Even if you're feeling totally fine, it's super important. Those visits let the doctor monitor your cortisol levels and look for any signs that the disease might be coming back. And if anything seems off, they can adjust your treatment plan.
So it's all about staying vigilant and catching things early.
Exactly. It's like tending a garden, you got to weed regularly, or else those pesky plants will take over.
I like that analogy. Okay, so let's circle back to radiation for a sec. We talked about how it can sometimes affect those other hormones produced by the pituitary gland. Can you tell us a little bit more about which hormones are most vulnerable to radiation damage, and what are the consequences for patients?
Sure. Remember our pituitary gland orchestra analogy?
Yes.
Well, radiation can kind of mess with the harmony of the orchestra.
Right.
By affecting the instruments, the cells that produce these hormones.
Yeah.
So the hormones that are most commonly affected by pituitary radiation are growth hormone, thyroid-stimulating hormone, and the hormones that are involved in sexual function, like luteinizing hormone and follicle-stimulating hormone.
Okay, so what happens when those hormones get disrupted?
Well, if growth hormone production is affected, especially in children, it can lead to growth delays. And a deficiency in thyroid-stimulating hormone can cause hypothyroidism, which can lead to fatigue, weight gain, and other metabolic problems. And if the sex hormones are affected, that can result in things like decreased libido, infertility, and other reproductive issues.
Wow, those are some serious consequences. It really highlights the importance of weighing the risks and benefits carefully before deciding on radiation.
It really does. And that's why it's so crucial to talk openly and honestly with your doctor about your situation, your concerns, and your goals.
Right, because there's no one-size-fits-all approach to treating Cushing's.
Absolutely not.
It's all about figuring out the best path for each individual patient.
Exactly. And it's important to remember that surgery and radiation aren't the only options. There are also other treatments, like medical therapy and adrenalectomy.
Right, we touched on those a little bit earlier, so let's go into those a bit more. What exactly does medical therapy for Cushing's involve?
So medical therapy uses medications to try to control the overproduction of cortisol. And it's often used when surgery or radiation aren't the best options, maybe because of other health issues, or because the patient prefers to try medication first. It can also be used as a bridge therapy to help manage symptoms, while waiting for surgery or radiation to take effect.
So it's like using medication to kind of calm down that cortisol storm.
Exactly. And there are different types of medications that can be used for Cushing's, and they all work in different ways.
Can you give us some examples?
Sure. So some medications work by directly blocking the production of cortisol. In the adrenal glands, these are called adrenal enzyme inhibitors. And then there are others that work by interfering with the way cortisol acts in the body. Those are called cortisol receptor blockers. And then there are also medications that can help control some of the symptoms of Cushing's, like high blood pressure or high blood sugar.
Okay, so it's a multi-pronged approach.
Right.
Some medications reduce cortisol production, while others block its effects.
Exactly. And the best medication for each patient depends on the individual and how severe their Cushing's is.
That makes sense. Now, what about adrenalectomy? That sounds pretty intense.
It is a more invasive procedure. So adrenalectomy involves surgically removing one or both of the adrenal glands.
And those are the glands that actually produce cortisol, right?
Yeah.
So by taking those out, you're essentially cutting off the source of the excess cortisol.
Exactly.
But wouldn't that leave the person with no cortisol at all? And isn't cortisol essential for life?
Yeah, you're right. Cortisol is super important. It regulates metabolism, the stress response, the immune system, a bunch of really critical processes. So after having an adrenalectomy, patients have to take hormone replacement therapy for the rest of their lives
Yeah.
to make up for that missing cortisol.
So it's a trade-off
Yeah.
for getting rid of the problem.
But then you need lifelong medication to replace that hormone.
Hmm.
It's another one of those tough decisions. And it's typically only done when other treatment options haven't worked or aren't a good fit for the patient.
I see. So treating Cushing's is like this constant balancing act, trying to weigh the pros and cons of each option and figure out the best approach for each person.
You got it. And it's not just about the physical aspects of the disease either. We also have to remember that Cushing's can really impact mental health.
Oh, that's right. We haven't really talked about that in depth yet. How does Cushing's affect mental well-being?
Well, like you said earlier, cortisol is a stress hormone. And when cortisol levels are high all the time, like they are in Cushing's, it can really mess with the brain.
Okay, in what ways?
Well, people with Cushing's often have a lot of different psychological symptoms, like anxiety, depression, irritability, mood swings, trouble concentrating, and even cognitive impairment.
So it's like their mental resilience is constantly being worn down.
Exactly. And it's really important to recognize and address those psychological effects, not just focus on the physical symptoms.
So if you treat the Cushing's, do those mental health symptoms typically improve?
In a lot of cases, yes. As the cortisol levels go back to normal with treatment, the psychological symptoms often get better or even go away completely. But sometimes people might need some extra help, like therapy or medication, to really address those mental health effects.
So it's about taking a holistic approach, recognizing that Cushing's isn't just a physical disease, but one that affects the mind as well.
Exactly. It's about treating the whole person.
Right. Well, we've covered a lot of ground today. We've really gotten into the complexities of Cushing's disease and the different treatment options, from brain surgery to radiation, medical therapy, adrenalectomy, the impact on mental health. It's clear that there's no easy answer when it comes to managing this complex condition.
No, there isn't. But, the journey isn't over yet. We still have some more to explore.
That's right. We're going to take a quick break, and then we'll come back to talk about some of the exciting possibilities for the future of Cushing's treatment. All right, so we've been talking about all these different approaches to treating Cushing's. But what about the future? What's on the horizon that could change the game for people living with this condition?
Well, I think the future of Cushing's treatment is really exciting. There's some amazing advancements coming down the pike that could totally revolutionize how we approach this disease.
Okay, I'm intrigued. What kind of breakthroughs are we talking about here?
Well, one area that holds huge potential is personalized medicine. Imagine being able to tailor treatment to each individual's unique genetic makeup and the specific characteristics of their tumor.
So instead of a one-size-fits-all approach, we're moving towards treatments that are customized for each patient.
Exactly. And genetics is a big part of this. Researchers are finding all these genes and genetic markers that can influence how people develop Cushing's and how they respond to different treatments.
Wow. So do you think genetic testing will become a routine part of Cushing's care in the future?
It's definitely possible. Imagine being able to do a simple genetic test and know whether a patient is more likely to benefit from surgery or radiation, or whether they're at a higher risk of certain side effects. That kind of information could help doctors make much more informed treatment decisions.
That's incredible. It feels like we're going from a world of guesswork to a world of precision medicine.
I agree. And it's not just genetics that's driving this personalization trend. Technology is playing a huge role, too.
Yeah, we were talking about those amazing endoscopes used in surgery earlier.
Right. But there are other really cool technologies emerging
Hmm.
that could transform Cushing's treatment even further. One that I find really interesting is focused ultrasound.
Focused ultrasound. I've never heard of that.
Yeah, it's a non-invasive technique that uses high-intensity sound waves to target and destroy specific tissues in the body. It's kind of like using a magnifying glass to focus sunlight. You know how it creates intense heat at a specific point?
Yeah.
Well, focused ultrasound is similar. In the case of Cushing's, it could be used to target and destroy the pituitary tumor without any incisions or radiation.
Wow, that sounds almost too good to be true.
It's pretty amazing.
So no surgery, no radiation, just sound waves zapping the tumor away.
Right.
Are there any clinical trials looking into this for Cushing's?
Yeah, there are actually several trials going on right now that are investigating the safety and effectiveness of focused ultrasound for pituitary tumors, including the ones that cause Cushing's. And the early results are really promising.
That's incredible. To think that we might have a non-invasive treatment option for Cushing's one day.
It's definitely a possibility.
What other technological advancements are we looking at for the future?
Another one that's generating a lot of buzz is artificial intelligence.
AI.
Yeah, AI is already making a big impact in lots of areas of medicine, and it has huge potential for Cushing's care, too.
I know AI can be used to analyze medical images and help doctors make diagnoses, but how else could it be used for Cushing's treatment?
Well, imagine having AI algorithms that can analyze tons of data, things like medical records, lab results, imaging studies, even patient-reported symptoms, and then use that data to identify patterns and predict how individual patients might respond to different treatments.
So AI could help personalize treatment plans even more by taking all those different factors into account?
Exactly. And it could also be used to monitor patients remotely. So if there are any signs of recurrence or complications, the AI could alert the doctors right away.
So like a wearable device that tracks cortisol levels and other health data
Yeah.
and sends real-time updates to the healthcare team?
Right.
That would be amazing. It would give patients so much peace of mind, knowing that their condition is being monitored around the clock,
It would.
and it would allow doctors to intervene early if any problems come up.
Exactly.
Wow, AI really has the potential to revolutionize how we manage Cushing's,
It does.
moving us towards a more proactive and personalized approach to care.
Yeah, it's really inspiring to see how research and innovation are pushing the boundaries of what's possible in medicine. It gives hope to people with Cushing's and other complex conditions, knowing that better treatments and a brighter outlook are on the way.
Absolutely.
And while we're talking about all these advancements, it's important to acknowledge the strength and resilience of the people living with Cushing's. Their courage and determination are what drive the search for better treatments and inspire researchers to keep pushing forward.
This deep dive has been amazing. We've learned so much about Cushing's disease and its treatment, from the intricacies of the pituitary gland to the latest cutting-edge advancements. We've talked about surgery, radiation, medical therapy, adrenalectomy, the impact on mental health, and even the future of personalized medicine, focused ultrasound, and AI.
It's been quite a journey.
We've only scratched the surface of this complex topic, but hopefully we've piqued your interest and inspired you to learn more. Remember, knowledge is power, especially when it comes to your health.
Absolutely. Don't be afraid to ask your doctor questions, explore reputable sources of information, and advocate for your own well-being.
And on that note, thank you so much for joining us on this deep dive into Cushing's disease treatment. Until next time, keep exploring, keep learning, and keep those brains buzzing.
See you next time.